questions using the chat box. And if you would like to have a further discussion, depending upon the time availability, you can raise your hand. Please participate in the poll. We will be having two polls. So I would request you all to please participate. And webinar recording will be available in Empower School of Health YouTube channels. This webinar is live on our YouTube page. The objective for today's webinar is to outline the career option available in pharmaceutical management. Now this is time to launch poll 1. I would request backend team to please launch poll 1 and then we will continue with the webinar. Thank you. There are a few generic questions. And also relatively to the topic for today's webinar, I would like to mention you all that we have a course recently launched in pharmaceutical management. That is a PGD, postgraduate diploma in pharmaceutical management. For more information, please visit our website or you can refer the link that will be posted on the chat box. So I would request you to please participate. There are a few generic questions about you, so it will help us to know about our audience for today's webinar. That is, what is your gender, age, geographic region, academic background, and about your work experience and in which sector you are actually working on, what is your area of work, and which type of organization you're working with. So we will be posting this poll for a few more seconds and then we will continue with the webinar. Also, for any questions that you will be having, please put it on chat box and that will be acknowledged by the speaker for today's webinar during the Q&A session. Also, the certificate for webinar will be sent to you all post-webinar. So you will receive a link in which you need to fill up the form and the webinar certificate will be sent to your registered email ID. I can see 39% of attendees participated in the poll. I would request you all to please participate promptly so we can proceed further with the webinar. %54 of attendees has participated. So that means half of the attendees hasn't been participated in the poll. 10 more seconds and then we will proceed further. I would request backend team to please stop the poll so we can proceed further. Small brief on poll 1. The maximum attendees are male and that is 55%, 45% female. The age group maximum we have between 40 to 50. Then geographical region, Africa and Middle East, that is 90%. Academic background, 40% from pharmacy diploma bachelor's degree. Then about work experience, attendees between 6 to 10 years of a work experience we have today. From maximum attendees from private sector, and I can see which type of organization, wholesale and distribution, hospital and clinical. Okay. How did you hear about this webinar? Empower email and Empower social media. I can see few of the attendees from APN. Thank you all for your participation. Now we will move forward with the next slide. Now I would like to introduce Professor Andy Barraclough. He's a global health expert. Professor Andy, over to you. Thank you.
Okay, thanks. Okay, greetings to all. I hope you can all hear me well. Just very quickly, our agenda for today. I will speak for around 30 minutes and then give you a chance for question and answers. You can type questions at any time into the chat box. At the end of the webinar, you'll have a chance to ask questions directly. I'll ask you to unmute and you can then ask the questions. Please do not unmute until I ask you to do so. I will call your name. So our webinar today is looking at career options in pharmaceutical management. And I'll explain exactly what that means shortly. Who am I? Well, I'm Andy Barraclough. I'm the Emeritus Professor of Public Health at the Empower School of Health. I've been working in pharmaceutical management for over 30 years. And I've worked with many operations in both the public and the private sector. And I see today we have a lot of private sector people with us. That's good because I'm also experienced in that sector. Most recently, I've worked on COVID like everyone else and monkeypox, mpox, vaccine rollout throughout mainly Africa, but around the world. If we try to look at the careers in pharmacy, we see that in recent years, certainly over the last 10 years, the role of pharmacists has expanded. There's now far more diverse settings available. Clinical pharmacy has probably always been there, but it's expanded now. There's more of that happening. Roles in pharmaceutical industry, of course, have always been there, but there's more roles now directly linked with pharmacy. In academic and research and teaching, yes, again, roles, but expanding well beyond pharmacy into areas of supply chain, into areas of overall public health. And it's those public health areas in particular that have expanded greatly. The pandemic has brought home to many people the need to prepare, to be ready, and that goes beyond simple pharmacy, goes beyond simple supply chain, requires many factors to be considered. And an area which is increasingly coming up is regulatory affairs. And people often misunderstand. They think only the government is in charge of regulatory affairs, a statutory office. That's not the case. There's a lot of regulatory affairs. The majority of regulatory affairs officers are employed in the private, commercial sector. Relatively few in the public sector. So there's many roles now for pharmacists. The roles have expanded greatly, new roles and existing roles to encompass new areas, new fields. But many of these roles require management and leadership skills. And those are often not available. They're not present. We need to have those management and leadership skills. It's no longer the case that a pharmaceutical qualification alone is enough. Having a degree in pharmacy is a good start, but it's no longer enough to secure those roles, those jobs in other settings, in regulatory, in industry, and outside dispensing. You need this management, this leadership training to be able to occupy and fulfill those roles. So the key point around pharmaceutical management is that it's a combination of modern management practices with pharmacy. And it's a complex field. It's a challenging field because you need to know about pharmacy and you need to know about management principles and practice. It's not just learn a few things on the job. You need this management training. You need this management and leadership background in order to be qualified to enter and to fulfill those expanded roles in pharmacy. Lots of publications around pharmaceutical management, lots of journals around it, but fundamentally it is the combination of pharmacy and modern management practices. Well, how is pharmaceutical management different from pharmacy management? And it's very different, so the terms can be a little confusing when we use them together like this. Fundamentally, pharmaceutical management focuses on business and management, particularly of the pharmaceutical industry, such as strategic planning, regulatory compliance, product development, and market launches. Whereas pharmacy management focuses on the daily operations of a pharmacy, such as dispensing prescription, advising clients, managing the pharmacy staff and inventory, and safe storage. So fundamentally different. Pharmaceutical management highlights and strengthens the management aspects. Of course, there's some overlap between the two fields. They're not completely separate. They're not completely siloed. Supply chain is one where elements of both come together, pharmaceutical management and pharmacy management. But fundamentally, pharmaceutical management is around the business aspects, and pharmacy management is around the patient aspects. Well, which one is right for you? Well, that depends on what your core interests are. If you are passionate about patient care, then pharmacy management is the one for you. It's a much better choice. Patient care, clinical roles, clinical pharmacy, that is pharmacy management. If you're passionate about the business side of healthcare, you enjoy leadership roles, you enjoy management positions and aspects in pharmaceutical companies or healthcare organizations, then pharmaceutical management is a better choice. Ultimately, it has to be your decision. There's no completely right or wrong decision. It depends what you feel your focus is around. But to enter most of these positions, you will need management training. So if you're going to go towards the business side, you will need management and leadership training. But again, you have to decide early on that you want to enter into those business skills. And we normally talk about 11 key business skills: communication, goal settings, leadership, critical thinking, financial management, networking, time management, negotiating, project management, marketing, creativity, and innovation. Only if you're looking and you're drawn towards those skill areas, it's right to enter pharmaceutical management. Otherwise, pharmacy management is a better choice for you. Well, what do we mean exactly by this pharmaceutical management? It's the process of ensuring that pharmaceuticals are safe, effective, and accessible to patients in a health system. That includes a whole manner of activities, such as managing supply, and there is some overlap with pharmacy management. Ensuring that medicines are available and consistently supplied to health facilities and practitioners, applying business principles. That's often not been emphasized in studying pharmacy. Business principles are extra to that. Using a business mindset to bring pharmaceutical innovations to markets. Considering equity and balance. Ensuring that medicines are affordable and accessible, analyzing data, whole set of statistics and data analysis to look at, studying market trends, customer feedback, usage data to determine which products to focus on. It's not all private sector. On the right, we can look at pharmaceutical management to meet universal health objectives. Lots of areas there, all pharmaceutical management, which apply mainly in the public sector. So pharmaceutical management is applicable to both areas, but there's probably more career and job opportunities in the commercial private sector. Well, why do we need this pharmaceutical management? We've been studying pharmacy, we've done pharmacy, we know all about medicines. What do we need this? Because we need to ensure that the policies, the laws, and the governance around pharmaceuticals are observed. That means ensuring quality care. That means planning, organizing, controlling, development, manufacturing, distribution, and the use of pharmaceutical products. We have to control the whole process to ensure it complies with policies, laws, and governance. Improving patient care, consistent supply of medicines. What to do when patients don't have medicines and attendance decreases? How are we going to manage that situation? What can we do to promote patient care? Improving pharmacy operations. Often software can help improve quality of service, can certainly help with stock management, billing, insurance, and more. And of course, career growth, because pharmaceutical management opens the doors to many new areas which you may not have previously considered, focusing solely on pharmacy management rather than pharmaceutical management. So this pharmaceutical management brings management for the observance of the policies, laws, and governance around pharmaceuticals. Well, why has it suddenly become all important, this pharmaceutical management? We've been doing things for 50 years the same way. Why do we suddenly need this pharmaceutical management now? Well, in fact, we've always needed it. But the COVID-19 pandemic really brought home, not just to people in the healthcare profession, but the politicians and the regulators and the managers, the need for a robust pharmaceutical infrastructure, for realistic demand planning, to have preparedness for pandemics, to be able to respond much more rapidly, and to streamline supply chains. They have to become far more robust and resilient. We've always needed that, but COVID-19 brought it home to people outside the healthcare profession. The politicians, the financial people, everyone involved in overall healthcare management suddenly realized we need to have this. That's part one. Part two is the rapid technological process. We're seeing personalized medicine, and that's hugely expanded the scope of pharmaceuticals, requiring a lot of demand planning and very skilled profession to navigate the rapidly changing regulatory landscape. What was permitted a year ago is not permitted now. What's the role of AI in pharmaceutical management? It needs to be there and realized. Data breaches, the whole information management and data processing, that has been brought home by the rapid technological progress. So a double whammy. COVID-19 pushed it, and then this technological process, particularly people talking about AI. What does AI mean? What are the regulations for AI? How are we going to control them? That's all part of pharmaceutical management. Well, why do we need training? Why do we go off and have to go study to do pharmaceutical management? Because in general, pharmacy courses do not teach you management, and management courses do not teach you pharmacy. You need a combination of skills. Yes, you need pharmacy, but you also need modern management principles, the systems and the techniques. But those systems and techniques cannot be general management functions. They have to be focused and be relevant for pharmaceutical operations. Go off and do an MBA, it's excellent. You'll learn all about management. But most of it will not be relevant and focused on pharmaceutical operations. Learning about the failure rate of spark plugs for petrol engines is very good, but it's not much use to you in pharmaceutical management. There are, of course, common core areas of statistics and data analysis, but it needs to be focused. The management principles must be focused around pharmaceutical operations. And we see many complaints that pharmacy schools are not teaching business management and marketing. They can't. It's already an intense course just to teach pharmacy. You can't add more things in. Management is, again, on top of this. Extra training and modern management techniques in particular require serious study to acquire the skill sets needed. Well, what do the courses involve? This is the Empower course. What are the course objectives? Principles of pharmaceutical management, strategic analysis. How many of you undertaken that? Regulatory compliance and stakeholder engagement. All new areas for many of us. Communication, marketing, human resources. Master research methodologies, critical analysis. Drug regulations. Every year, more drug regulations. Pharmacoinformatic techniques. Very few schools of pharmacy teach pharmacoinformatics as part of the regular degree course. It's extra, it's above that. Medicine policies and financing mechanisms on access. How are we going to achieve universal healthcare without new financing mechanisms? How are they going to impact pharmacy? Research projects and communicate findings and written reports effectively. I'm sure you've all read academic journals where you're not sure what it says. You're not getting effective communication from the research. Learning how to make reports effective, how to communicate findings of research effectively so they have real meaning and real use. The Empower course, the postgraduate diploma course, generally over a period of about 12 months, but you can work at your own pace. 2 semesters covering these areas. Of course, the introduction, starting then into strategic management. How do we do that strategic planning? Medicine policies, communication, health supply chain in the pharmaceutical industry, going beyond pharmacy into managing all health products. Pharmaceutical marketing, and for those in the public sector, you might think that's not relevant. But yes, it is. We still have to get patients to accept. Part of that acceptance and compliance we can consider to be marketing. Drug regulations, human resources. Do you have enough staff? Do you know how to calculate how many staff you need? Do you know the skill sets? How are you going to set that up? How are you going to work through the system? Pharmacoinformatics, communicating effectively. Of course, then a big one, pharmaceutical financing mechanisms. Who's going to pay? How is it going to work? How is it going to come together? Can you influence that situation? Can you be a leader to influence that situation? Why would you choose the postgraduate diploma? Why wouldn't you go for a master's degree? Well, if you've got the time and the money, then that's a very good option. But if you want to enter the field, and in low-income countries, you need something that can get you into that field, then this would be the course for you. The main areas around that you get career advancement in that you get more doors open. Practical skills, you bring a global perspective, particularly important for the supply chain. Where do your medicines come from? In Africa, 90% of the medicines come from outside Africa. Around 80% come from India. But where does India get the API, the active pharmaceutical ingredient, from? About 80% comes from China. So we've got China to India to Africa. We've got this global supply chain, which can be easily disrupted. We don't have a global perspective and no international regulations and practices. We can't hope to be strategic in our planning of overall pharmaceutical operations. It's a 12-month course. The information's on the screen. There's more on the Empower website all about the course. Well, how does this qualification, this postgraduate diploma, affect your career prospects? It increases the range of pharmaceutical activities available. In effect, it opens the door to leadership roles. Some examples of the positions would be pharmaceutical purchasing manager, quality assurance manager. And again, people tend to focus on the public sector. These are needed in the private commercial sector as well. Regional healthcare manager, going beyond pharmacy into general healthcare. Project managers for specific activities, statistics directors, a growing field of data analysis of statistics, learning how to work with them and what they mean. Drug development directors, new formulations, new medicines introduced. How are we going to get them to work? In TB, we had no new TB drug for 40 years. And then when we bring a new TB drug, it didn't get taken up. It took 15 years before countries started using it. We have to be able to manage that situation much more strategically using drug development directors. Regulatory affairs, lots of job openings there in the public sector for enforcement, in the private sector for compliance. What are the regulatory affairs? How do we comply with the regulations? What do they mean? Consultancy roles, generally you need at least 10 years experience, but at least it opens the door to enter that area. Quality control, and that's different to quality assurance. Quality control is around manufacturing of the medicine. So manufacturing the product, quality control of the product. Another general one, healthcare manager. Lots of new roles that you may not have considered and thought about before. So what are the roles possible? Pharmacy manager. What does he actually do? Oversees the development and marketing of pharmaceutical products. Make sure that they have regulatory requirement compliance. That's an area I'm going to emphasize a lot, this regulatory compliance. And the majority of that function is in the private commercial sector. Regulatory affairs manager. Standards both domestically and internationally. Many countries have signed international agreements. Are you following those agreements? Not just on the product itself, not just on the pharmaceuticals. What about data collection? Almost certainly your country has signed data collection compliance. Are you observing it? Well, that's part of the regulatory compliance. Clinical operation manager for clinical trials, increasingly come into low-income countries now. Make sure they're ethical and efficient. Supply chain managers, most of you are well familiar with that role, overseeing logistics and distribution. More important now because of the global supply chain. COVID's brought a big wake-up call for the supply chain, need to develop a robust and resilient supply chain. Then healthcare consultants assisting companies on strategic decisions. Does this make sense? Does this comply with the regulatory conditions? Why does it apply in my country? The market entry strategies. Does it make sense? Is the formulation correct for my environment? Well, what does a product manager actually do? Well, they include research. That might sound strange. How is the product manager doing research? If he doesn't have the market trends and looks at what's happening, he can't be sure. He can't manage the product. Key area of the management principles is this strategy development. What is your strategy? How will it enter the market? How will it be active in the market? Communication, very important. The strategic goals and priorities, communicating with patients, with the general public. Look what happened in COVID. We lost trust. Nobody trusted us because we didn't have effective communication. We have to learn how to communicate in an open and transparent way with the public to regain that confidence and trust. Coordination, lots of different teams to pull together and make sure they're all going in the same direction. Brand strategies for branded products, Pre-approval market readiness. You know how long it takes to get market approval for a medicine. Pre-approval, getting everything in place, getting everything ready to go. So those are the kinds of roles around project manager. And to fulfill those roles, you need sound management and leadership principles. Well, are there actually any jobs going for these product managers? Well, don't listen to the old professor. Have a look yourself on the internet and you'll find out these are all commercial company jobs. These are in Asia, but you'll see some salaries posted up. There are jobs there being advertised now today for these positions. Well, what about regulatory affairs? How is that doing? Safe and effective of healthcare products. And often that means going beyond pharmacy, catheters, syringes and needles. What are the regulations around those? You probably didn't study that very much in the pharmacy course. What are the regulations around dressings and packs and gowns and robes? We saw the complete disaster in COVID of PPE, personal protective equipment, did not meet international standards. It was useless. The UK destroyed millions of pounds worth of substandard fittings. Who's got the information? Who's got the knowledge on those healthcare products, going beyond just pharmacy into everything that comes into the healthcare operation? So as a regulatory affairs professional, you have to stay up to date. And there's new regulations, there's new legislation all the time. Guidelines for the industry, different scientific requirements. How are you even going to measure the requirement and if you meet it? Of course, also data collection and analysis. And remember all the rules around data. What can you collect? What can you keep? How you analyze it? What's the regulation on patient confidentiality? All of that to observe. And all of that is new to many people who are coming solely from a pharmacy background. So ultimately, regulatory affairs careers are ensuring compliance with all the rules, regulations, and laws. And are there any jobs? Well, different areas. There's the portfolio lead. To get a new drug approved, you typically have to produce a portfolio. Sometimes we use the French word dossier of all the data, all the information. Pulling that together is a massive effect. Generally, they come in at about 10 kilos of paper for the regulatory approval on a dossier. Lots of things to pull together, lots of information to come. Advising on regulatory affairs, advising NGOs, advising commercial companies. Public sector, head of regulatory affairs and the responsible pharmacy, ensuring how you're going to get compliance. Starting point, perhaps regulatory affairs assistant, starting off in the base of the profession, looking at regulatory documents and sample compliance, and a regulatory affairs pharmacist, because often only a registered pharmacist can undertake some roles in regulatory affairs. So those are the kinds of positions. It's not all public sector. The majority of positions are in the private commercial sector, and there's different ones, different roles within that broad categorization of regulatory affairs. Are there any jobs? Well, these are mainly from South Africa, just some I pulled up. Again, they're all in the commercial sector. Lots of jobs there for regulatory affairs. Again, don't listen to an old professor. Go and look on the internet yourself. Are there really any jobs? Do they pay real money? Is it active? Would I be able to get a job with this qualification? Well, on that point, let's just stop for a moment and have a reality check. Does a qualification in pharmaceutical management guarantee you a job? And the simple answer is no. No qualification is ever going to guarantee you a job. The point about a qualification in pharmaceutical management is it increases your opportunities and your job prospects. It does not guarantee you a job. You still have to work, you still have to push, you still have to promote in order to get there. Who employs pharmaceutical management staff? All the international pharmaceutical regulatory agencies. So people think of those only being from Europe or the USA, but for example, here's a position, United States Pharmacopoeia in Kenya, advertising for a regulatory person in pharmaceutical management. International NGOs, like Management Sciences for Health, again, advertising for that based in Johannesburg. Of course, UN agencies and mainly commercial pharmaceutical companies. They are the people that have the largest financial base and they employ the most number of people. Well, is AI going to make you all redundant? Artificial intelligence is coming and surely you won't need any more pharmacists. The robots will do everything and you're not required. Possibly, but not for a very long time yet. Here we see the prediction that it's going to be very hard to take away the responsibilities that pharmaceutical management currently requires. It's going to be in demand. It's going to require humans for a very long time yet. It's the only way to ensure the maximum level of accuracy. It's about human consumption and health. It needs people. So, whilst artificial intelligence will certainly affect activities, it's not going to replace the workforce for a long time yet. Okay, I've talked rather a lot. Time for question and answer. Let's just have a quick look what's in the... Okay. Okay, let's see, go to the front, see what we've got. Okay. I'm in pharmaceutical management for 10 years and would like to make a shift career into pharmaceutical management. How do I enter it and make a shift? Right, basically you need some kind of management training. That's how you need to pursue that. You need pharmacy and management. So I think that's the basic answer. If you want to enter into pharmaceutical management, you need management training. There are various options for how you get it. The Empower course is certainly one. There are other options. Think around how you can get that management training. The role that basic research in pharmacy can contribute to pharmaceutical management, please. Basic research, no. What happens is pharmaceutical management research is focused around the management principles. It's not out there looking at blue sky new drugs. It is managing what we've got there, research into the management processes, into the overall operation, rather than developing new drugs itself. How to launch new drugs, how to bring them to the environment, certainly. Pharmaceutical management, me as country coordinator in Zambia, yes, that is a role. As a country coordinator, I would expect you to be experienced in pharmaceutical management. It would require management training as well as pharmacy for that to happen, but that would be the ideal role for a coordinator. Okay, that's about masters. I suggest you take that up with admin. Okay. Do I need to have a degree in pharmacy to take this course? No, you don't. But you do need some healthcare background. Generally, you need a first degree and some healthcare background to undertake the course. We do not teach very much pharmacy in the course. It's mainly management the course teaches. But you don't need to be in pharmacy. You can be in related areas if you have experience in the healthcare sector. Open the office in Zambia, please. The WHO in US no more than in Zambia. Don't quite understand that. Medical doctor of experience in supply chain, yes. In digitization, yes. Then I think the data management course would be better for you. If you look on the Empower website, there is a data management course. That is excellent for digitization. I think that would be the better role for you. How different? Okay, pharmaceutical management and supply chain. Supply chain is part of pharmaceutical management, but pharmaceutical management goes beyond the supply chain, encompasses other areas as well. We do have a master's program, but not in pharmaceutical management. If you look on the website, you can see the master's programs that are available. We currently have 3 master's programs. Have a look on the website, all the different ones available. In addition, we also have postgraduate diploma courses. We don't have a master's degree in pharmaceutical management yet. How is this course will increase my opportunities for career in NGOs? Many NGOs want pharmaceutical management. If they're healthcare NGOs, particularly if they're international NGOs, they want people who can manage, who have those management skills that go beyond pharmacy. So yes, it will increase your opportunities with the NGOs. How long does the MSc pharmaceutical management training at Empower last? Right, we don't currently have PhDs at Empower, so it will not lead to a PhD of Empower. A number of our students have gone on after the master's course to PhDs in other universities. PhDs perhaps for the future. The MSc course is 2 years, and there's a number of MSc courses. Okay, we have a few minutes left. If somebody would like to speak, please raise your hand and I will try and come to you. Okay, I don't see any hands. No. If you want to just unmute and speak and ask a question, that's okay. Just go ahead and unmute and I will try to answer. Okay, Temesgen, yeah. Please unmute. You need to unmute. Okay, good. Please ask your question.
Thank you very much. I'd be honored to attend this meeting, and I'm very happy that you spoke to us. And I have one question that is all the time revolving in my mind. And I went through the internet a number of times, and I have MSc in social pharmacy and pharmacoepidemiology, and I'm trying to go for my PhD in the same field or in related field. Like, for example, in pharmaceutical marketing, I tried no course is there, no program in PhD, and pharmaceutical management as well. I'm highly interested in that pharmacoepidemiology, even if it is a bit, uh, there are opportunities. It's not as much as clinical pharmacy or pharmaceutics or pharmacology. And again, in pharmaceutical supply chain also, the chance is there. And global universities, I think, has, I can say, they have ignored this program. Uh, why is this so? Why is this happening? And what would you recommend the universities to do as a scholar, as a professor? And your advice for me also, how can I just realize this dream?
Okay.
Thank you.
Right. There are very few PhDs in pharmaceutical management available, I am afraid. One of the reasons we started this course is because there were no courses available. That's what we do. And UNITAR, our partner, regularly identifies missing areas like this which countries need. So at the moment, I don't know of any PhD places in pharmaceutical management. There are in clinical pharmacy, as you say, many, but not in pharmaceutical management. There are possibly more MSc courses coming along in pharmaceutical management in the near future. Okay. Sorry, I can't be much help on that one, but it's not there. Patience, you asked about scholarships. Yes, we do have very, very few scholarships. You can try to apply for them on the course if you want. It's really very few because we receive very little funding from external agencies, even though we try very hard. Largely, it's up to you to find the scholarship. You have to lobby in your country, all the major donors, European Union, USAID, UK DFID, everyone that you can think of, you have to lobby them and they will sponsor you directly. Very few of the donors like to give us block grants for scholarships, although we do try regularly. Every time I go to Geneva, people hide because they see me, they run away, they know I'm going to push them for scholarships for our courses. Okay, anyone else would like to speak? Please unmute and ask your question. Kenneth, go ahead, please.
Good morning, sir.
Greetings.
Yes, sir. Okay, I don't have a background in medicine or pharmacy. I only have a background in management. Can I still go ahead with the course?
You can certainly, but if you have a background in management, you might not need the course. You may already have, if you have already experienced management training. We don't teach very much pharmacy on the course. It's management of medicines. But if you have a background in management, I would suggest you're better off taking one of the other courses that are more linked and provide a more clinical background with it.
So which will you advise me to go for?
I would go for the MSc. Have a look on the Empower website. Look at the MSc. I think that would be a better option for you.
All right, thank you, sir. I appreciate it.
Eves, please go ahead.
Yeah, hello. Good afternoon. I don't know if it's good afternoon for you. Yeah, for me, I'm a pharmacist. I've applied already for the masters. Then I have got a confirmation from Sonia, but I would like now to know when will we start that program.
I will leave that for admin to answer. I'm sure they'll email you directly after this webinar. I don't know, but I'm sure that Sonia or Priya will take care of that and will email you directly. I'll make sure it happens.
Okay. Thank you very much.
Okay, if there's anyone else, we have a few minutes if you want to unmute and ask a question. Let's see what we have in the chat box. Okay, Ibrahim Kaliokan from Côte d'Ivoire. Therapy s'appelle cabinet. Right, I'm sorry, Ibrahim, at the moment the course is not available in French. Okay. That will probably come in a little while, but at present time it's English only. But I'm interested to hear of your production on plants and vegetable oil. Okay, interesting. Okay, last chance. If anyone wants to ask a question before we close to the next poll. Okay, Sonia, then over to you for the next poll.
Thank you, Prof. Andy. And thank you, attendees, for your questions. Now, I would request host to please launch poll 2, and I would request all attendees to please participate. Also, in addition, this webinar is live on our YouTube page, and the certificate of participation will be sent to you all post-webinar. So the link will be provided to you. You need to fill up the form. The certificate will be sent to you. This webinar was organized in collaboration with APN Kenya, who's our partner. And for any questions, you can reach out to us. I would request host to please launch poll 2 now. I hope all can see poll 2 now. There are a few questions. And this is basically a feedback poll, which will help us to improve in our future webinars. If you have any questions related to the topic for today's webinar, please drop an email to us on the email ID that is mentioned on the chat box. Also, if you would like to know about our courses and our offering, depending upon your area of expertise, please visit our website, and we have numerous of courses that is available on the website. If somebody would like to try the free courses that is available on the website, you can please do so. Thank you all.
Thank you.
Poll will be live for a few more seconds. I would request you all to please promptly respond on the questions. The questions are very generic, as in, what was this information useful? Are you interested in exploring any digital health courses? So I'm so sorry, this is not specifically related to digital health courses, but you just put your interest over there. Then which courses training are you interested? We have numerous of other fields, that is digital health, pharmaceutical, management, health leadership, global health, cybersecurity, and some more. The fourth question is, which type of training and courses are you interested? So online certificate, online diploma, PGD, and masters. So we have masters and PGD available with us depending upon the duration, that is 24-month course masters in supply chain management and 12-month PGDs in different domains. So that is digital health, data management, and pharmaceutical management. We also have partial scholarship with us. So please write us too if you're interested for the course. Now I would request host to please end the poll. And thank you all for your presence for today's webinar. Special thanks to Professor Andy for his insights about the topic. And for any questions, please write us to us at the email ID that is mentioned on the chat box. Thank you all.
God bless you. Sorry, please. I've not finished filling my form. Can you please revert back so that I can finish that?
That's okay, sir, because poll has already been stopped, so it cannot be reinstated again. Your feedback has been taken. For more information, please get connected with us.
Okay. All right.